and support the students to get exposed, to get the support of private sector in terms of developing their ideas, piloting their ideas. We'll be working with the university on research and generation of evidence. There are many areas that are not touched, but also that we do not have the answers for. Our collaboration with the university will be enabling us and giving us the opportunity to tap onto those research projects. And finally, the exposure. We're gonna, as I mentioned, give the students the opportunity to participate in joint events, hackathons, facilitate alumni network meetings, and get involved in inspirational speeches. The project has actually started in 2018. That was basically starting up the hubs, setting up the place, reaching out to different interested donors, platforms, increase our visibility. The focus in 2019 will be on research and generation of evidence, but also capacity building and creation of challenges. We're looking at having well-established startups. I'm coming into targets in the coming slide. So the aspirations, we're looking at reaching out to 100,000 students through different media channels. 300 students actually receive our technical support and technical trainings, engaging at least like minimum of 50% female students. 75 students will be benefiting from incubation activities, with as well 50% female contribution or participation. Will be seed funding 15 business ideas. We'll develop 9 researches and feasibility studies. We'll be reaching out to 200 students, and to support those students are initially expected to reach out to surrounding communities. Like the students support the surrounding communities to the universities. Of course, and this collaboration I'm presenting here will be directly working with the Jordan University of Science and Technology. It's one of the reputable universities in Jordan. It's in Irbid, and considering the burden that is have been handled in Irbid and the Northern Governorates at large. There is a wide domain to improve the WASH sector, basically in the innovation entrepreneurships. Just as no secret, the efforts that they've been investing in developing these two sectors, they've already very well established, and we're building on those collaboration opportunities. So the project just started in December 2018. It is managed by the Center of Excellence for innovative projects, basically by Dr. Ziad here in the front row, Dr. Ziad Al-Zawi, the technical focal point, and Dr. Fahad, the overall managerial focal point. We will be building or like needing the capacity of a couple of staff. Basically, the priority areas will be WASH or household water security, water reuse, virtual and green water, hygienic behaviors, non-revenue water, leak detection, groundwater recharge, IWRM tools, and climate change adaptation. We have a couple of main thematic areas on stormwater drainage, extreme events, climate change, hygiene in schools and in universities, water harvesting, grey water use, and finally water quality and water treatment. Thank you.
Thank you very much, Hiba. I think this presentation is clear to all of us. Is about the innovation hub. Jordan is a middle-income country. Is again lesson learned. It's a reflection of where are we going on the WASH issues, and always we comes with the big developmental projects. We comes with the relief interventions when the time of the crisis. but people are left with no chance to do research, do innovation, to engage youth, and this is what UNICEF and sector partners thought might be an ideal to have, and Jordan's been leading in the region in many fields, many directions, so that's going to come up as a model project, same like what has been done by the USAID. Of course, is about the youth and how to engage the youth and how to get lots of good things out of the youth. And we in this region, coming out from this region myself, we've been very much being impacted by the extremism, by lots of issues, which has been driven the attention of our youth and get all the energy that we might use for something that concerns our country. And it's from the priority list, it's clear that it's been picking up on issues related to climate change, water scarcity, and how to engage them through a famous institution led by national academic strategists who are going to lead this exercise. Now we have 20 minutes before the tea break. I am going to give a choice for you. We did three presentations. The one from Jordan on the management of water initiative, and the second one is from Gaza, lesson learned on WASH and the surveillance system, and the last one is a hub innovation, and all of them are related to sustainability in a way or other. Of course, we have heard about sustainability, the functioning and the use, and how benefit to the equity, quality, commitment, efficiency, how see things continuing by time, how we see capacity building of the locals being leading their own initiative, how to replicate, and how to ensure the operationalization, how to ensure also no impact to the management. As I said, I have an offer for you. I have a movie to show you about the WASH. It's been produced recently by a CU professor, a friend. Who, for those who are not familiar with the WASH is a UN water sanitation and hygiene package. If you want me to show you that, or otherwise, it is a 10-minute. We can take 10 minutes from the questions, or we go on the questions. Who like to see the movie? Please raise your hand. Okay, who like to ask questions? Only two. Okay, then we'll leave the two questions for you at 5 minutes before then. Ahmed, can you help me with this movie, as I said, is being prepared by Alejandro.
Welcome everyone to this introductory chapter about water sanitation and hygiene. My name is Alejandro Jimenez and I am the Program Director for Content Development, Water Governance at SIWI, the Stockholm International Water Institute. To begin, I want to share with you some images that show the scope and gravity of the effects of lack of water and sanitation. Inadequate access to wash services is not only related to health issues and the protection of the environment, it is also about poverty, violation of human rights, and gender inequality. In the past decades, and particularly during the last 15 years, global coverage of the use of improved drinking water source services and sanitation facilities has increased significantly, but we have a lot more to do, as lack of access to water and sanitation is linked to a number of diseases, principally diarrhea and cholera. Diarrhea is still today the 5th world leading cause of death and the 3rd in low-income countries, causing almost 7% of all deaths in those regions. By inhibiting normal consumption of foods and absorption of nutrients, diarrheal diseases are also an important cause of malnutrition, leading to problems in physical growth and cognitive development for children, reduced resistance to infections, and potentially long-term gastrointestinal disorder. diarrhea is also a substantial economic and social burden, leading to loss of work or school attendance, expenditure on medicine, and other problems. Having access to water and sanitation can have between 20 and 45% of reduction in diarrhea, depending on the case. But the most effective way is to combine this with improved hygiene. Simple hygiene improvements, such as correct hand washing, can lead to a 45% reduction in diarrheal diseases. Changing those hygiene behaviors is often the most crucial step in achieving health gains, but is many times neglected in programs and interventions. There are a set of different ways by which water and sanitation services are provided. From a multinational water company to a water vendor on the street, water and sanitation is provided different ways. This is what we call service delivery model, the set of mechanisms and actors involved that provide the services. The models for service provision need to define roles and responsibilities, stipulate contracting procedures, and who is in charge of the arrangements, tariffs, and other parameters of service, leading to efficient and effective water and sanitation services. Models for service provision need to define roles and responsibilities, stipulating contracting procedures, who is in charge for operation and maintenance, tariffs, and other parameters of service. These possible models for service provision depend very much on the density and the size of the population. Very isolated households might even serve themselves, while in big cities, the service provision typically requires professionalized companies to manage the network. The typical models for water are the following: self-supply, where households or a small cluster of households provide their own solutions to water supply by constructing their own water points. This form of management is most typically in highly dispersed communities. This is still a common option in many developed countries for very remote areas as well. Community-based management, where communities have been delegated responsibility to operate and manage water facilities. This option includes many differences, from purely voluntary committees to those with systematic support, to those outsourcing tasks to private companies, but where the community retains governance and oversight. Direct local government provision, where local governments directly carry out these services. This is also sometimes referred to as direct municipal services. Public utility provision, where a separate public entities assigned or establish at central, regional, or municipal level to provide management of services for communities or small towns in the designated area. And finally, private sector management, where you have private operators, either they own the water assets and manage the services, or they have been delegated responsibility for operation and maintenance. So through public-private partnerships arrangement. And these PPPs, as they are typically called, may or may not involve private capital investment to build or extend the assets. Different PPP contracts can be applied, ranging from a service contract which only entails minimum delegation of responsibilities to the private operator, to a concession contract where the private operator is in charge of investing in new assets as well as operating and maintaining them during the contractual period. So many different possibilities are available. When it comes to sanitation, the typical model include two. First, the community-wide approaches or total sanitation approaches, which aim at a complete change in the behavior of the community and not in an individual household behavior. They are inspired in the community-led total sanitation approach, which aims to achieve and sustain what is called an open defecation-free status for the community. This approach entails the facilitation of the community's analysis of the sanitation profile, the practices of defecation, and the consequences through what is called a triggering exercise, leading to collective action and peer control to become open defecation-free. It promotes community-based innovation for the construction of latrines, which might not necessarily be improved. Marketing of sanitation goods and services based on the social marketing concept, is another model where you try to use marketing strategies and techniques to achieve the social goal. In case of sanitation promotion, social marketing covers both demand and supply. It sees potential sanitation users as clients who need to be motivated to invest in a latrine or a toilet. And the services and the products must be available at an affordable price in the right place. In urban cases, sanitation has different models. It can be the sewage network that we know in many developed countries, but it's not the most prominent solution for developing countries, which are typically on-site sanitation solutions and off-grid. That means lettering septic tanks that need what is called fecal sludge management processes, which include the emptying, transport, and treatment of fecal sludge. In all cases, these service provision models have different challenges, but a few common of them that we can refer to are the following. First, the sustainability of services, understood as to keep the services functioning over time with the quality that they were intended for. Lack of sustainability can be triggered by the lack of an adequate service delivery model or insufficient capacity for it to be delivered. Lack of financial viability of the services, understood as the capacity to generate sufficient funding to cover operation and maintenance costs, replacement and extensions. In the case of rural sanitation, it might happen that the houses do not have the ability to rebuild the latrines or the toilet if it has been damaged. Lack of resilience, understood as the capacity to adapt to and respond to shocks and stresses, particularly related to climate change. Second challenge is to reach the most vulnerable, to achieve universality of services. In many occasions, the people without service are the most vulnerable and harder to reach. So reaching them needs sufficient political will and an extra technical and financial effort to make progress. Integrating of water sanitation services and hygiene, multiple uses of water are essential for improved well-being of the population. So addressing these challenges must be at the top of our priorities to achieve the sustainable water and sanitation services for all. Thank you for listening.